A very good evening and a very warm welcome as well to iMed on Channel I. Now, usually on iMed, what we do is we invite an expert in the medical field to discuss about various types of diseases regarding the human body and have some discussions, some insightful conversations with regards to the disease. So today we are going to touch on a topic which is quite out of, I would say, the public's reach, and a small branch, but a very important topic. We have today the survival of a cancer patient when he or she has STD, or the STD, specifically HIV. It could be anything, STDs. So to talk about this, we did invite an expert in the subject. Consultant oncological surgeon Dr. Nayomal Pereira is here with us in the studio. So a very good evening to you and welcome aboard the show.
A good evening to you.
And it's a pleasure having you here as well. Now, getting right on with the questions, how common is it for a patient to have STIs and getting cancer, developing cancer with the existing STI?
Actually, there are no sort of real statistics or data to sort of exactly say what percentage of patients with STI or STDs progress towards cancer. But this is a very rare entity, and as you said, it's not commonly discussed as it is so rare. And the worst scenario is some of these cancers, although the cancers that is seen among the STI patients are commonly seen, they try to sort of hide the causative factors, what caused them to sort of get these type of cancers. One good example we will be discussing later on is about cervical cancers. Now, cervical cancers are very common cancers which is gradually going down, but if you ask the patient whether they had any exposure to sexually transmitted diseases, they will deny. So it is very difficult to sort of give statistics, but it is a very, very rare entity and very interesting one, and it could occur because of sexually transmitted diseases. Few of them can get cancers.
So it is not quite common, but you could say there is the possibility of always developing an STI into a cancer. Now, if I ask you in a medical perspective, because you are an expert in the field, how do STIs cause cancers?
Now, when we talk about STIs, we tend to know the acute symptoms. I mean, as soon as a person gets exposed to a partner, or maybe to a person who is carrying the sexually transmitted disease, the infections or the bacteria or the viruses, they get the acute symptoms. Now, the acute symptoms might disappear, or sometimes they could have asymptomatic disease where there is no symptoms at all. But the germ or the virus could be sort of gradually growing within their system, and when they get it, it is quite late, because for the cancers to grow, it is not that fast. Although we believe that the cancers grow very fast, that is only at the latter stage. So at the beginning, the growth is very slow. So we could sort of say that the cancers occur during the chronic stage of the sexually transmitted disease. So it is not at the acute stage. Some people might not even remember whether they had that type of exposure when they get a cancer. For example, have liver cancers. Now, that can be caused by hepatitis B virus infection. I mean, when you ask the patient whether you had any exposure or any contact with a person who had a hepatitis B virus, they might say, no, I never had. But they could have ended up in having a liver cancer after about, say, 10 years or 15 years. So the symptoms wise with related to sexually transmitted disease are really at chronic stage.
And doctor, what type of cancers can a patient expect to develop in later times? As you said, the STI's chronic stage can develop to a cancer. What type of cancers are those?
Now, when you consider sexually transmitted diseases, as we know that when there is some intimate contact or some mixture of genital secretions in that exposed areas, a patient can get acute symptoms or the sexually transmitted disease. And gradually, when it progresses to the chronic stage, they can get a cancer. So when we talk about the intimate contacts, but the skin-to-skin contact, there is no immediate risk of getting a cancer or later on even. For example, we know herpes simplex can spread as a sexually transmitted disease from skin to skin, but that type of disease will not give rise to a cancer. So it should be a sort of a deep infection which progress inside the body. So the common ones are the cervical cancers, which is actually the opening or the opening of the womb, which females tend to get it quite late in life. Cervical cancers, then of course with the penetration they can have anal cancers, or even in the oral cavity throat cancers they can get, and certain infections which spread via the bloodstream, they can get like hepatitis progressing towards liver cancers. So these are the common cancers that anyone can get I mean after many years after exposure to sexually transmitted diseases.
And I want to get our attention to an infamous disease in our society, and some might consider it taboo as well, which is HIV, and the chronic stage is AIDS. If you talk about this, what actually happens is the immunity goes down. Does it actually directly serve towards a cancer, towards developing a cancer, or what's the procedure like if we consider the disease of AIDS?
Now when the examples I gave earlier, like the cervical cancers, anal cancers or throat cancers, those are actually where the virus will sort of grow within that area specifically. Now not only in the cervix, it can grow within the anal canal as well as in the vulval area in the female, and also in the males they can get penile cancers, that is the male or genital organs. So in those areas the virus grow within a cell and cause some change of the genetic composition of that particular cell for it to progress towards a cancer. But in HIV it's totally different. Now in HIV we know the immunity is depleted and the immunity goes down. So that particular individual is vulnerable to sort of any virus that can give rise to a cancer can grow in him, because he cannot destroy this. Now at the beginning, as I said, the other cancers where the virus goes into a cell and cause some genetic composition, our immunity system plays a very, very vital role to destroy these things. So that's why all the patients, say for example, somebody might ask, okay, I have been smoking or using tobacco for many, many years, I have not got a cancer. But an individual who has smoked for about maybe for a couple of years would have got a cancer. So then a person might ask, okay, how come I survived smoking tobacco? So because the immunity system is very well developed, and they have very important cells which can kill the cancer cell itself. So the cancer will go down. Now this is the problem with HIV patients, because their immunity is not up to the optimum level, and they cannot destroy these cancer cells which are growing. So in HIV patients, what you get is opportunistic viruses growing in their system, leading towards a genetic abnormality or causing some genetic changes which can progress towards a cancer. So it is not confined to an area where they are exposed in the sexual activity. It can occur anywhere. So in HIV patients, we can see a slide as well. In HIV patients, the cancers can occur in the oral cavity, they can get on the skin surface. There's one entity called Kaposi sarcoma, which is very common, which is a skin cancer. Then they can get melanomas, they can get oral cancers, they can get anal cancers, they can get even lung cancers or even liver cancers, which are all internal organs. So that is mainly because if a virus goes in and cause some damage to a cell where his lymphocytes or there are certain other cells will not be able to destroy this cancer cell which is growing inside, because their system or the immune system is lacking in the proper functioning.
I think that was an all-round answer how HIV or AIDS can actually develop, or how that can contribute towards developing a cancer in a patient. And doctor, talking about the treatment, say for example, there are various type of treatments when it comes to cancer developed by the aid of HIV. what are the vaccines available? Because vaccines are highly demanded in these days. Say for example, we had COVID. So vaccines, can we keep our trust on vaccines, or what are the vaccines available to prevent STDs which might later on develop into a cancer?
This is a very important question, because the vaccines have been introduced, and it is even in Sri Lanka we have introduced the vaccines for human papillomavirus, which causes cervical cancers. That is one reason that we have recently seen that the cervical cancer rates are gradually going down, and also for other reasons as well. But anyway, now for the HPV virus vaccine, that is for cervical cancers, has been introduced within the national immunization program as well. So there have been all the girls around 10 to 12 is given this or introduced this vaccine, which comes in 2 doses, and it can be started even at age of 9. And somebody might ask, okay, I am now 26 or about to marry, whether I could sort of get the vaccine. Yes, provided they are not sexually active at the beginning or not yet, then they, of course they could sort of take the vaccine and have some protection. So it comes in 2 doses, and it has been approved by the FDA in the States, even for males, because males, the penile cancers can be caused by human papillomavirus. So the same virus that causes cervical cancers. So for them also it has been introduced for males to use the newer HPV virus vaccines, but in Sri Lanka it is introduced only for young girls who are around about 10 to 12. Then the other vaccine is hepatitis B vaccine. Now hepatitis B vaccine, especially the hepatitis B virus, is spread via the blood components. So it is basically who are sort of undergo dialysis, where their blood is mixed within the machines, and if the machine is contaminated with the virus, or maybe intravenous drug addicts, where they inject the drugs into their system. So these people can get this type of hepatitis B virus get into their system, and which later on progress towards hepatitis and cirrhosis, and finally ending up as liver cancers. For these type of patients also, they can get vaccination done for hepatitis B. And not only the drug addicts, HBV virus is a potential hazard for in the medical profession as well, especially the doctors or the medical staff who handles blood products, like in the blood bank, or maybe surgeons who are directly exposed to blood products while they operate, especially when they use sharp, maybe the blades or maybe the instruments, then the needles, that you can accidentally prick yourself if you operate on a HPV virus patient. Because we don't know, we don't sort of routinely do, we don't routinely screen them whether they are infected with hepatitis B. So because of that, that health sector personnel as well, they have been introduced to get their vaccination done against hepatitis B. So those are the 2 vaccines which are available at the moment, which could prevent these type of infections, and later on where you can sort of get protected from developing a future cancer for these people.
Now, as you said, doctor, there are vaccines and there are other ways of treatments to the patients who get cancer by an STI. So how would you address the fact or the matter where the confidentiality or the privacy of a patient, because if we actually think about from the perspective of the patient, some might be reluctant to even talk about the disease. They have, even the first stage is denial. They might even deny that they have something like that. Other than talking about the confidentiality, the start point is restricted in its track itself. So the hesitancy to open up, what's your take on that?
It is true, it is up to the patient to sort of keep it, look after their privacy. I mean, some people, they come and sort of tell the truth. Of course, it is always good if a patient knows that about the past, where they had sort of multiple sexual exposure, or maybe some sort of into drug addiction. So it is always better if you can reveal these matters to or discuss these matters with the doctor, because this is very important. It is not only that you should sort of get yourself treated, you should sort of look after the the medical profession who is sort of handling their illnesses. So I mean, sometimes when we realize that the patients are not telling the truth, even though we take precautions, if we feel that this person would have been in a sort of working in a health resort for many years, or who have been drug addict, because we can sort of see certain things from their history, we can identify and say, okay, this patient would have been, the reason would have been the some sort of a sexually transmitted disease which he has got exposed many years back. So if it is so, what we usually do is we take maximum precautions. I mean, handling these patients, we use double gloves, and we are very I mean, keen and sort of make sure that we don't sort of have accidental pricks when we sort of handle these patients.
Making human errors, basically.
That's right, and to minimize the human errors, that's what we do. And somehow we maintain the confidentiality. Whatever said and done, we don't reveal it to the patients in the ward. And I mean, in the sense, I mean, we might sort of tell only the one or few medical nurses or the attendants who are looking after that particular patient, not to sort of tell it to everyone. So that is, and we don't sort of keep them for many days in the hospital as well. We try to sort of treat them and sort of discharge them. And also we tend to advise them that to take, this is also very important point, where these patients should look after their partners, whatever said and done, because that in the virus, if it is still remaining, it can spread from them to your loved ones. So we always tell them to use some sort of a protection whenever they have some intimacy later on, just to prevent your partner getting infected with the sexually transmitted diseases which could end up in a cancer later on. So it is, when you consider these type of diseases and cancer, I think there are three aspects into sort of to discuss. That is, we discuss the vaccination, then the protection, and the awareness. So I mean, everybody should be aware. I mean, very few people probably know that sexually transmitted diseases could end up in a cancer. So I think this program is a very useful and a very important program to discuss this type of very rare entity.
And thank you for that, Doctor. And also, if you could elaborate on the fact on the ways to safeguard an individual from getting STIs and later on developing that onto a cancer. What are the ways one could use to safeguard themselves?
Yeah, the protection wise, I think sometimes a person, I mean, when we talk about this type of protection, we always think about the contraception part only. So we think, okay, and probably some people might get carried away thinking that it is same as protecting from getting pregnant. So it is not that. It is nothing to do with the contraception. It is basically you should have some sort of a barrier. So oral contraceptive pills, injections, hormone preparations will not work for these. Only a barrier. So either using condoms, those are the things that who the partner who is infected with sexually transmitted infection should wear this type of protection whenever they have some sexual intimacy, to prevent not only the infection spreading into your partner, and also for possibility of sort of blocking a future cancer being developed in them as well.
I think that was some good ways to safeguard. Actually, that's a good point that you brought up. The contraception part is not the only thing that we should be concerned about.
Correct, yeah.
And some other things that, like you mentioned as well. Now, we have come towards the latter part of the program as well, Doctor. Now, my final question to you would be, what is the message that you want to give out to the general public regarding the topic that we are discussing, which is survival of a cancer patient who has STIs or STDs? What is your message to the general public out there?
Yeah, my message is that most of the time when when you get exposed to these type of sexual activities, many people, they are concerned about the acute symptoms, because as soon as they get some sort of a symptom related to, immediately within a week or so, you tend to sort of go and take treatment, and once it is treated, you feel everything is over. But you should be aware that there are certain infections which can go all without a single symptom, and you will not feel anything, you will not have any issue. I mean, nothing, no fever, no weaknesses, there will be no discharges, no pain, nothing. So you tend to feel that, I mean, that would have sort of just gone, I mean, from my system. So people who are sort of into being sexually active with many partners, I think it is better at least you think about some sort of way of protecting yourself by using these type of, as I said about the protection, and also to get the vaccination if possible, because that will protect the disease getting into a chronic stage and developing a cancer. So the important message is, there are so many cancers which occur due to sexually transmitted diseases can be asymptomatic. They will not have any symptom, and it will not come or appear immediately. It might appear after many years when the disease is at a chronic stage.
So I think that's a good point as well. Being asymptomatic doesn't mean that you don't have the disease. So it's better if you just go to, but how do you know that you're at risk, doctor? That's something some might wonder who are watching. How can you, if you're asymptomatic, what are the ways that you could diagnose yourself?
I mean, that is a very difficult question, or difficult for a person to realize, okay, whether I will get it or not. It's very difficult. That's why sort of most of the people, they tend to sort of forget these things, and because once they sort of pass the acute phase, I mean, they think, okay, I'm sort of totally, I mean, cured, or there's nothing to worry. So this is actually the biggest problem that we face. So for that reason, I think if you are not very sure about your sexual partner, it's always good to have some sort of protection. It is not only for contraception, but to sort of prevent from getting a sexually transmitted infection. So I think that is the most important thing that a person should think about, especially if you are not limited to a sort of to your only partner, or then of course the protection is the only way. Otherwise, of course, they should think about some sort of vaccination, but that is only for human papillomavirus, HPV virus, as well as for HBV virus. So but there are other cancers which can spread, so because of that, it is always better if you use some sort of a protection.
Well, you heard from the expert. It's definitely important for you to get all the precautions that you could take to actually take all the prevention measures for you to resist getting STIs and later on developing that onto a cancer. So with that, we have to wind up today's segment of iMed, and we did discuss some important messages and important facts and points where we brought up some insights. Well, the doctor brought up some insights about the preventive measures that you could take to alleviate the symptoms and the disease. So we did have with us the consultant oncological surgeon, Dr. Nayamal Pereira, with us today. Thank you so much, doctor, for being here with us in an attempt to educate the public.
Thank you very much.
And yes, with that, we wind up today's segment of iMed. Thank you so much for joining in. Do tune in next week about a different topic. Until then, stay safe. Have a very good day.